This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
A lot of those solutions are already out there, and it's not only about looking at the bleeding edge of every new technology that comes out. Those certainly exist too, and some of them are still fairly theoretical in some regards. And I don't want us to be too distracted by that when we have these discussions around smart hospitals. There's plenty of opportunities for every type of healthcare provider in every region to be able to tap into these opportunities.
Welcome to Sg2 Perspectives. I'm your host, Trevor DaRin. Today, I have two colleagues from Sg2's Emerging Strategies practice, Andrew Rebhan and Nikita Arora, here to talk about the hospital of the future. There's an accompanying briefing they just created. It has some incredible examples, groundbreaking ideas. They're always the ones pushing the envelope, thinking furthest in the future. So I wanted to get them on to talk through this new research. Andrew and Nikita, thanks so much. Andrew, I'll go to you first. Why are we talking about the hospital of the future right now? Capital so tight for most systems. They're being really selective about investments. Are systems able to now think far enough ahead to say, oh, these investments are going to pay off. It's going to be worth it. Why do we do this research now?
There's several reasons why we started to go down this path. When you say the term smart hospital, people start to lunge ahead to thinking of the most advanced system that they can think of. But really, this is rooted in a lot of operational challenges that we see playing out across all different types of healthcare systems. When we went into the interview process and started speaking to our members, there were these clear root challenges of we just don't have enough staff or people to do the job right. We seemingly don't have enough time for the tasks that we need to do. We constantly struggle with managing capacity. And we also have a lot of data to work with, but we just don't have enough insights from the data to actually address whether it's workflow or operational challenges. Technology is not by any means a silver bullet to all of these challenges, but it definitely serves as a component for how we think about navigating those challenges. When we look at aspects of extending the reach of a constrained workforce, when we think about true possibilities for scalability, automating different tasks or restructuring workflows to boost productivity, having more predictive prescriptive guidance, none of that happens if we don't start to think intentionally around digital transformation. That's ultimately what got us down this path.
This past year and a half or so has been a period of bouncing back from the aftermath of the pandemic. And we're beginning to restabilize, finding that some systems have operating margins that are once again rising. In tandem, we've seen that rapid technological advancement. And it seems like there's a little bit of a window of opportunity to help address the constraints that Andrew mentioned, capacity constraints, staffing challenges. And the smart hospital is a step towards harnessing your data more efficiently, improving patient care, starting to reduce errors, and personalizing treatment all through the technology and AI and the Internet of Things. And the automation of data integration can help streamline these hospital operations. It can help reduce those administrative burdens and optimize resource allocation. You can use your predictive analytics to help manage patient flow, optimize staffing schedules, and even impact supply chain, which can influence and improve efficiencies. And the pandemic highlighted the need for the flexibility and resilience that healthcare systems need to embody. And the smart hospital better equips systems to help respond to such crises in a quick manner, adapting to new protocols and managing patient surges and augmenting and supporting remote patient care options. While there is a reality that building or upgrading to a smart hospital is going to require significant upfront capital and investments in tech and infrastructure, there is also a need for internal alignment on training and maintenance and safety and the ongoing implementation.
I like it. Okay, I'll give you a chance to prove it because it's easy to understand the promise here, but there's going to be an inevitable opportunity cost. And some of the things we're talking about were big cultural and institutional mindset shifts. So do you have some results or different areas in which systems are investing and what the payoff's been?
We took a focus on a couple select areas of a smart hospital concept in the process of building out this report. The first was smart patient rooms. The second was around digitally enabled surgical care. And the third was around command center operations. Now, smart patient rooms, many of the ones that we covered in our primary research either just opened or they're actually in the process of opening over the course of the next year. So early days as far as thinking of some of the results that we're seeing there, but clearly an experience play trying to bolster the sense of autonomy and control that patients often have in a patient room setting that can often feel a bit chaotic, a bit isolating, but also leveraging aspects of digital whiteboarding software, digital door signs, other means of communication that actually keep staff informed and helps to bolster their coordination of care. In those discussions, we've actually already seen through initial testing, initial mock-ups of these patient room spaces where they're leveraging something like that digital whiteboarding software or even implementing cameras to supplement virtual nursing workflows where, according to our interviewees, staff are saying, please don't take this away from us once they actually started to experience these changes leveraging these digital tools. So that's a patient room experience and some of the opportunities that we're already seeing there, even though it's still kind of early days for some of those new builds. But if I were to highlight another example from the research, if we're looking at something like digitally enabled surgical care, there's any number of different technologies that we could think about along the whole end-to-end surgical pathway. We could talk about AI-enabled risk prediction to 3D printed modeling to surgical robots to everything that happens post-op in terms of remote care. We could actually use a more practical example to draw this out in terms of leveraging predictive analytics for better managing operating room scheduling. In one example from the report, we highlighted Banner Health, which was looking to essentially optimize their OR scheduling and utilization. We know that there's lots of OR block times that actually go unused. Being able to leverage a platform that can plug into those core IT systems to have greater visibility and transparency into how these OR blocks are being leveraged, but also being able to predict which are potentially repurposed in the most optimal way. So this is a system that can actually provide those behavioral nudges to surgeons or the scheduling staff to encourage them to actually release those block times based on historical data that shows that it's likely to go unused, and then being able to actually repurpose that time for some other surgeon who's actually available. Through this process, they were able to add 2 additional surgical cases per OR per month. They had a 2-fold increase in early released OR block hours. That meant releasing hundreds of freed block times per month to repurpose. Patients have more timely access to surgery, and they were able to break even in 2 months. This is not by any means the most advanced, hyper-futuristic use case of technology. We're talking about predictive analytic functions and automation that goes into scheduling for the sake of surgical planning. But this is something that's directly impacting your financial bottom line. It's getting patients into an OR faster. That's not even to say all the other technologies that can be occurring in the operating room that can be providing that ambient intelligence related to how we do the procedure, but also how the care team itself works side by side. There's so many other factors at play here, but just scoping down to that one use case, we could see those tangible results.
Workflow management is greatly influenced by the AI integration. Another example from our briefing is Health First, which partnered with the company LeanTask to help implement a digital platform for managing inpatient flows. And the AI platform really helped enable that predictive analytics in understanding what barriers exist as it comes to discharges and created a prioritization for patients on when they should be discharged, as well as provided real-time availability for beds and staffing. There are a number of benefits that we listed out within the briefing, and you can check it out to see what all of those are. But just to name a few, nearly 200 hours were found in reduction in manual data collection and phone calls per week. We saw a 35% reduction in hold times and nearly 45 minutes saved in daily staffing and plan communications. So certainly a lot of ways we can see that ROI manifesting.
Those are really good. Better results than I expected. Even if you had to just summarize and lump it into 2 bundles, a little bit of operational efficiency, but mostly you're solving a provider problem and making their jobs a little bit easier. And many would invest in technology. There's a lot of technology that promises that. So it's exciting to hear some of those results. For systems that are not yet prioritizing smart hospital investments, are there some even lower hanging fruit areas that are the easy first steps here? And at the same time, for those who've already made these investments, what are their next steps? What kind of problems are they hoping they can solve now that they have some good momentum going?
my mind goes to some aspects of robotic process automation that we've already seen for years, if not decades at this point. This really ties into a lot of the current generative AI discussions that we're hearing. I've been put in front of Vizient networks and other workshops of smaller community hospitals or rural providers, and the discussion topic is AI. And more often than not, the sentiment in the room is one of skepticism and doubt around how to actually leverage this technology. But ultimately, as we start to get through discussions, we realize that a lot of the functionality may already be used by these systems. They may not just know it as explicitly. And this could be anything from just thinking about how we automate aspects of supply chain or automate prior authorization functions or start to leverage more digital intake tools to help with the process of gathering information or surveys or whatever else we need from patients before they come on site. There's actually a lot of these little pockets of technology that may already be in play. They may already be embedded within your EHR. We don't think of this as a smart hospital solution in its own way, but if we think about it more as a collection of different processes and functions, it starts to paint that bigger picture of a self-driving hospital, an environment where staff are being augmented by these capabilities to do their best work, and tackling some of those core root challenges of how do we work with a limited staff supply? How do we work with these time constraints that we're always dealing with? And how do we better manage data? A lot of those solutions are already out there. And it's not only about looking at the bleeding edge of every new technology that comes out. Those certainly exist too. And some of them are still fairly theoretical in some regards. I don't want us to be too distracted by that when we have these discussions around smart hospitals. There's plenty of opportunities for every type of healthcare provider in every region to be able to tap into these opportunities, even if it means not everyone's going to be building a hospital from scratch. We're talking about the possibilities of choosing a single unit or a single floor and being able to pilot a solution and have your staff be able to provide that feedback in that limited test case to be able to say, okay, what's working, what's not working, but also allowing them to have that transparency so that there's no innate resistance to this just based off of some big bang implementation that overwhelms them and the workflow that they have day to day.
And I'd even take a look at it from a step back and examine that the concept of a smart hospital or smart system extends out throughout your entire care continuum and the entire care journey. It can also be a shift in remote patient monitoring to be more of remote patient comprehensive management as smart devices become more capable of collecting complex data and computing that data. We're going to see AI helping with a lot of that more mundane day-to-day tasks for providers, helping redefine how their days will look. And because this is an area that I focus, looking at it from a care at home lens, being able to have quicker connection to providers through video, phone, email, and text, having that real-time data upload, and even increasing the use of hospital at home care opportunities from that lens. To the second point of your question, what it reminds me of is a quote that we got from Chad Kellogg at GE Healthcare. During our research and interviews, and I'll paraphrase, the traditional definition of being a smart hospital was who has the most technology. But now we look at smart and we think about what's the next best step. And there are sometimes going to be 100 different variables to consider. And so it's about making the smartest move, considering what's best for the patient, the care team, the department, and the hospital.
As you asked, Trevor, what are those leading health systems thinking about as next steps or even further into the future? And I think it is that concept of thinking not just in terms of the hospital itself, but the broader reach into the home environment and the patient community. We had actually spoken with a chief transformation officer who phrased it as extending from a smart hospital to more of a smart health network. And to him, that's the broader picture of we should be tapping into these technologies to be able to extend the reach out into patients as they're living their daily life. And whether that's through something like a hybrid care platform where we're leveraging RPM devices, or whether it's the even smart home concept where we have this sensing network that's consistently collecting data, providing situational awareness, giving us the opportunities to have timely interventions. Whatever we think of as smart doesn't need to be contained within the four walls of a hospital. That's where a lot of the leading health systems are going to continue to iterate upon this. This is not something that everyone has figured out yet. Certainly, this picture will evolve over time, but I think that there is definitely some innovative health systems that are already planning for this.
With that in mind, we've talked about some that are already making investments, some places that you think systems are going to make some early impact. Did you find there was an overarching philosophy that systems had to have to be successful here?
To really feel like a smart hospital, we found that a lot of the core IT infrastructure and emerging solutions needed to be fully integrated with operations. So there was a concept that we had built out in some of our other research that we labeled as systems of integration. So we're thinking about all of the technology investments and the common denominators that come with those. And we focused in on systems of record, which could be like your EHR, for example. It's basically centralized storage and retrieval of core data assets. There's systems of intelligence, which is all the real-time data processing and analytics. There's systems of engagement, where we focus in on bringing positive experiences, building relationships with our patients. Systems of coordination, which is more around just task management for care teams. And then systems of efficiency, which is all around just reducing those manual, time-intensive workflows. When we think about those 5 systems of integration, all of these different solutions that we're talking about throughout the report and in discussions with our members, the idea is we need to have a way of considering how each individual technology investment rolls up into one of those systems of integration. Otherwise, we're basically just sporadically investing in technology without a real plan. Certainly having that initial goal setting and transparency around what is the problem, but also how do we think about this from more of a integration perspective, ensuring that whatever technology we're going to invest in is going to be able to link up into this broader platform that will allow us to really enable whatever goal we had set for ourselves. I think that's ultimately the sort of philosophy that we saw coming out of these discussions with our members.
There will need to be a bit of a cultural reset, both internally and externally, with our patients, of course, becoming more comfortable with having these technologies integrated into their hospital rooms and understanding how they work and how they're going to benefit them. But also internally, with staff becoming more comfortable, even planning departments, as you figure out what your next move is going to be, being more comfortable in taking action and making pivots as you figure out what the best fit is for your organization. It's going to require really engaging your stakeholders early on and continuously throughout the entire process, so information and plans can be coordinated and disseminated at the same time. It's also about figuring out how you can best future-proof. As you go into some of these new builds or processes, from the design to actually opening or standing up your program, if you don't build things out with a future-proof model in mind, you're going to be old on day one before you even open. There are going to be technologies that emerge that didn't exist when you initially began your planning process. Incorporating that future-proof model will allow you for implementing new technologies without having to fully redesign the building or revamping your entire process.
Thank you both so much. This is a terrific report. It's a great nudge to those systems that are not yet prioritizing smart hospital investments, and you do a great job of showing the benefits it can have for providers and patients in doing that. Always value your perspective. Thanks for listening. If you like this episode, please subscribe, rate, and review us, and/or follow us on Twitter and LinkedIn at Sg2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, SG2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You can find them at Vizient /podcasts. Have a great day.